Hello, everybody. My name is Randy Yerden. I'm the founder and CEO of Biospherics, and I'm really happy to be able to talk about building a cytocentric testing facility with you today. This is a unique venture, and I'm planning on giving you first a little insight into the word cytocentric, and then I want to, point out the testing capabilities of the facility. And then I want to end up with a brief overview of our equipment so you understand, how this idea came to be. And I'm very impressed with the decision makers at Wake Forest Institute of Regenerative Medicine for understanding how critical, this testing capability could be to the regenerative medicine industry. Cytocentric is a word that we refer to when we talk about meeting the needs of cells. Now, a lot of science has gone into understanding the needs of cells, and there's really been a pattern over the years that has arose by going beyond the normal needs of people and the normal practices, because these patterns kind of have led to some emerging quality concepts for live cells, which we call cytocentric principles. Now, I'm not going to go into these in real deep, but quality product is essential for regenerative medicine. And these quality concepts are going to become more and more important. And currently, the challenge is there's no way to test them. And that's why there's a lot of hope that this testing facility can really fill a gap for the developers of these exciting new therapies. First of all, cytocentric essentially puts the entire cell production process inside an incubator. This is unprecedented. It's not a normal incubator, but it serves the same purpose as an incubator. And why is this of interest? Because full-time optimization of the critical cell process parameters of temperature, CO2, and oxygen, which are universal for all cells, full-time optimization at all the steps in production, not just incubation, can improve substantially, some or all of the typical critical quality attributes. Currently, in most production processes, optimum conditions are only maintained inside of incubators or bioreactors. But in cytocentric practices, these optimum conditions are maintained in all the other places cells are produced. And this is something that can be tested only, as far as we know. It's the only place in the world where any cell therapy developer can bring their entire production process and test this improved process control. Cytocentric also offers physiologic cell manufacturing, and simulating physiologic conditions is primarily thought about in the context of oxygen. And why is this important? Because most primary cultures, which are those sourced directly from patients, and most stem cells are exquisitely sensitive to oxygen and actually favor really low levels. And now, for the first time, it's possible to control a low level of oxygen, as low as 1% or even 2%, through the entire production process, not just in incubation. And what is physiologic and what is optimum, of course, depends upon the cells, but that's the bailiwick of our testers. Whoever wants to look at this has that ability. And this may be the only place in the world, again, where any cell therapy developer can test physiologic oxygen manufacturing over their entire production process. Cytocentric always completely closes any entire cell production process. Why is this important? Because closure makes the cell production process completely independent of the environment. But a lot of people are fearful that it'll somehow adversely affect their process. And this is what the testing facility is all about. How we normally look at cell production is illustrated on the top, where we have biosafety cabinets on one wall and incubators on the other, and the different equipment spread around the room. And what we do is we close all the critical steps and we configure them in closed modules to accommodate the workflow. And this entire closure has extremely significant benefits in every way. But people are fearful of it, and our Cytocentric testing facility will give them the option to see just whether it does, have any effects on their cells or not. But the bottom line is this may be the only place in the world where, again, any cell therapy developer can test this complete closure, on their entire cell production process. Another interesting, unique capability is Cytocentric makes aseptic independent of antibiotics and independent of chemical microbial biocides, which is usually considered absolutely essential. And the bottom line is the reason this is important is because antibiotics, in many of them, actually damage mitochondria, which in turn damage the cells. And chemical biocides, which are used as disinfectants and as the sterilants and fumigants, they can also damage cells. And it may not be the direct exposure that's worrisome, but it's the residuals and the off gases which can have significant effects. And the problem during routine use of these is that the effects in many cases can be insidious. Now, using our proprietary cell-safe approach to close the entire process with no air inside and self-sanitize it with a physical method that's safe for cells, it's now possible in the Cytocentric testing facility, which may be the only place in the world where any cell therapy developer can test the benefit of aseptic production without the danger of biocides. Now, let me qualify that our system can absolutely routinely produce aseptic product, cell product without any biocides, but just be aware that we don't advise that, but what we do teach is how to radically reduce the use and the risk of biocides, and that's something that now can be tested at this facility. And of course, the expectation, anytime you move from a lack of quality practices to quality practices, you can expect better cells. The challenge is it's hard to predict exactly what those benefits will be. We've never seen a negative effect, but the positive effects, are hard to predict. They can be, in some cases, dramatic, in some cases, very marginal, in some critical quality batch attributes, but significant in others. So now there's an opportunity to test it. And finally, I want to give you a brief overview of our equipment. The ex vivo system is the only cytocentric cell manufacturing platform out there. And we occupy a unique niche in the different options for manufacturing GMP compliant clinical grade cells. Before our system, there were three options. Clean rooms are obviously the dominant one that has been around forever and is probably the method that's producing more cells than any other method. But traditional isolators with air inside and filtered air, they're gaining more and more interest all the time for good reasons. But the real sweetheart option has been, in the last few years, has been these closed devices. These are really phenomenal. And anybody who can fit their process in would pick these because they're so practical and capable. But that's the problem with many developers is they can't fit their process inside these devices. And that's where we come in. We occupy a unique position in the industry. We're the only closed system that is out there to our knowledge. And the unique capability of our closed system is that we can accommodate any production process, no matter what it is. And the distinguishing feature that makes us a closed system is a little bit non-obvious to most people. We look like an isolator, and just like we talked about earlier, where we just we accommodate any production process just by moving everything inside of a interconnected closed module assembly configured for the workflow. Um, but the real distinguishing feature is that instead of air inside, we have pure gases consisting of nitrogen, oxygen, and CO2 that come from tanks. And so this gas atmosphere, is best controlled at a level that would be equivalent to the same level you have in an incubator. And that's why we call our system a huge infinite modular incubator, if you want. And we also control temperature as well at optimum levels for cells, for example, dominantly 37 degrees. But this is the distinguishing feature that makes us not a traditional isolator, but rather a closed system, is no air. Now, our system does look like an isolator, and you operate it through gloves like an isolator. So I'm just going to flash through a bunch of pictures here to get an idea of what our system is like. Basically, small or large, you can configure them any way you want. They can be freestanding or tabletop. They can be, configured in all sorts of weird shapes to fit the process and to fit the space available. But we don't change your procedures. Everything you do in an open environment, we basically can accommodate in a closed environment. Essentially, what we do is we fashion an aseptic tunnel around your production process. And not only do we, keep it aseptic, but we also, again, optimize it for cell process parameters. We optimize the temperature and the oxygen and the CO2 throughout. So this is the essential difference between our system and any others. We also accommodate any of the equipment that you use in your process. And it really doesn't matter what it is. We have a 100% success rate, and also negating the negative side effects of machines on cell optimized conditions. For example, many machines give off heat and particles, and we negate these so that there's no disturbance to the cell optimized environment. But we can accommodate virtually any equipment, floor standing centrifuges or benchtop centrifuges, automation or filling machines, any type of bioreactors, other benchtop equipment, liquid handlers, analytic machines of any kinds. And wherever we have like this lyophilizer, wherever we have an opportunity to select equipment that has the mechanicals on the outside, this is a nice choice. We also have an interesting relationship with some of the closed device manufacturers for two reasons. Number one, they recognize that not all of their customers can fit all of their process inside their devices. So they've partnered with us to fill in those gaps. And also, some customers cannot use their closed devices outside of classified space. And those that don't have clean rooms have a very convenient way to put their closed devices inside of our classified space. So in addition, we use traditional ways of moving solid items in and out aseptically and liquid in and out aseptically. And there's a certain limit, obviously, to what makes sense to go inside. And this is how we interface to larger equipment on the outside. But the really unique, design of our product has to do with this modularity and this large library of modules that we can build systems out of. It doesn't take long at all to pull them out of stock and build whatever the customer needs to accommodate their process. This is fast. Of course, the bigger the system, the longer it takes, but under perfect scenario, we can do this really fast, and they can validate very fast as well. We can also configure the same production process in different ways to fit the space available. For example, this long system here would fit in a bigger long room, But if you had a smaller room, we would be able to angle the same production process to fit here. In an even smaller room, we could configure it in a U shape so that there was the ability to fit in the space available. And because these modules can be reconfigured so easily, there's never a dead end for the people that use it. So in an example here where you may decide you want to add a new automation machine to your process, maybe a 3D printer or that type of thing. If you want to upgrade your system, you simply build the new subassembly that would house the new equipment, and then split apart your system to add the new subassembly. And when you had it in place, you would be back in business. So this reconfiguration speed is really fast. So you never reach a dead end, no matter how you want to change, and you can scale it, in a very efficient way by this reconfiguration as need. You don't need to scale the whole thing. You can just scale the rate limiting steps. Adding robotics, new types of analytics are all simple. And this reconfiguration speed is fast as well. It kind of depends upon where the modules are located. But again, unprecedented ability to adapt to any needs you might have in the future. So we hope that this Cytocentric testing facility will benefit developers to see just what the tangible benefits might be to these Cytocentric practices. And we're very excited to interact with anybody who is interested in using it. And this is the top-down view of the versatile design that we started out with, but we can reconfigure it in any way within the space available to accommodate anybody's needs. And again, we have an expectation that every tester will see improvements, but it's hard to predict. But in essence, it may affect the critical quality attributes, in all sorts of unpredictable ways. Which ones it'll affect and how much are hard to predict. And it could be this, it could be that, it could be this. But in any case, now there's a way to actually measure. Thank you so much, and I'd be happy to answer any questions or talk to any potential testers.